All right, so next we're going to do a lumbar extensor endurance test. And for this, our patient's going to be in prone, but their elbows are going to be starting on the chair here. So Nick, I'm going to have you come onto your stomach and have your elbows rest on the chair here. Good. And then slide yourself forward so that way your hips are kind of right at the edge of the table here. Good. I can move this chair away a little bit too if we need to. A tiny bit more if you can. Perfect. All right, so that way I'm feeling for the ASIS and making sure that the ASISs are just on the table, okay? So then from here, I'm gonna use 2 straps this time. One strap is gonna go around the pelvis. And I would put it pretty low around the pelvis so that way your patient's a little more stable. You okay with that there, Nick?
Yep.
Okay. Then our second strap is going to go around the calf muscles. Nick, just let me know if this is too tight on you, okay? Is that okay?
Yep, that's good.
All right, and then I'm going to raise the table just a bit, Nick. So that way our patient's starting and maybe even some slight flexion, okay? Excellent. All right, Nick, so let me get my stopwatch. So the test here is going to be when we're ready, I'm going to ask you to just lift your arms and cross them over your chest. But you're going to try to maintain this kind of position in your back that's parallel to the floor. All right? So as you lift the arms up, position in your back should stay the same. Okay? Perfect. I'm going to leave the chair here. Okay? So that way when Nick is done, all he needs to do is place his hands onto the chair. Things I'm looking out for, making sure that he's maintaining a nice parallel position to the floor, that he's not resting his stomach on the headrest here, okay? If someone starts to fatigue and come down into flexion, they're going to passively rest on the headrest. We also want to make sure that he's not trying to shorten the lever and bring his head and neck into extension. So then can you do it just a little chin knot? Yeah, hold that position. Great. Very good. Lift from here just a little. There you go, Nick. Good. Again, looking for head and neck position, looking for trunk position. All right. Again, one of the more common things that you're going to see is the stomach starting to come down onto the headrest. All right. So as they start to fatigue, they're going to want to passively rest on the table. Good. All right. Excellent job. All right. So then when our patients are coming off the table after the extensor endurance test, we need to make sure that they're doing it carefully. Remember, they just did a max test, right? So things are going to be fatigued. So I'm going to take these straps off you, Nick. All right, now I'm going to help you back onto the table. So if you walk your hands up, walk them onto the table, come onto all fours. Very good.